Maintaining normal blood pressure or lowering blood pressure is no longer a worst nightmare, guys. On our previous video, I had explained about the meaning of blood pressure, the readings of normal blood pressure, the readings of hypertension or high blood pressure. So guys, if you manage to monitor your blood pressure and found out your readings were above the normal range, please visit your doctor for help, because this advice you cannot substitute. This is for those whose their readings are found that is normal or it's slightly elevated. But also, after visiting your doctor, this also is useful information to you. So, as you know, high blood pressure is the same as hypertension, and 50% of the research shows that heart attack, stroke, heart disease, kidney disease are caused by hypertension. This is a silent killer, guys. So guys, please, if your readings were above normal range, please visit your doctor immediately for help. So stay tuned, guys, as I reveal to you these strategies that will help us maintain normal blood pressure or lower blood pressure if it's slightly elevated, or it will help you to lower blood pressure after you visited your doctor. So, we have strategies, about 10 strategies, guys. And the number one is about diet. Our diet should have all foods such as fruits and vegetables. It should have legumes, nuts, and seeds. Our diet should have less processed foods. It should have less caffeine. It should have less salt, and it should have lean proteins like chicken, fish, chicken and fish. So guys, the next is about sodium. When you reduce the salt intake, when we talk about um, one spoonful of salt every day, like this one, guys, we reduce sodium intake, and this one will help us maintain normal blood pressure or lower elevated blood pressure, guys, because sodium stimulates the blood vessels. Again, we have to increase potassium intake, because potassium reduces sodium from our body. Again, potassium relaxes the blood vessels and reducing the blood pressure. Examples of potassium-rich food are like bananas, oranges, sweet potatoes, and spinach. But for people who have been diagnosed with a kidney disease or are using medications that retain potassium in their bodies, they should consult their doctor before changing their diet or changing their medication. Oh, yeah. So next is about exercise. Any form of exercise, whether it is intense, high intense, or low intense, it will help in reducing or lowering blood pressure. It will help us maintain normal blood pressure or lower the elevated blood pressure, because doing exercise regularly will help us reduce at least 0.5 to 1 kg per week, which is equivalent to 1 millimeter of mercury. So when we reduce 1 millimeter of mercury per week, we lower blood pressure naturally. We maintain normal blood pressure. We lower elevated blood pressure. Next is about weight. By doing exercise regularly, automatically we reduce weight if you're overweight. And for you, before you do your exercise, make sure you take your weight and height readings and calculate your BMI so that you will know if you are overweight, guys. So when you do exercise, you automatically reduce high blood pressure. You lower high blood pressure. Again, guys, about stress. When we manage our stress, we lower blood pressure because stresses elevates blood pressure. Alcohol intake. We should limit intake of alcohol. If you are used to taking alcohol, please reduce to 1 to 2 glasses of alcohol per day. And by doing so, you will do yourself justice of lowering your blood pressure or maintaining normal blood pressure. Another strategy is about sleep. Sleeping 6 to 8 hours per day is recommended because when you sleep less than 6 to 8 hours, chances of increasing or making your blood pressure elevated is very high. So when you sleep 6 to 8 hours, you maintain your normal blood pressure or you lower your blood pressure. Another one is um, quitting smoking. If you quit smoke, you automatically lower blood pressure because smoking adds nicotine, and nicotine stevens the blood pressure and increasing. Stevens the blood vessels and increasing blood pressure. So when you quit smoking, you automatically lower blood pressure or maintain normal blood pressure. Another one is about what's again? I think this is all. So guys, I've exhausted my strategies. If you watch until this end, thank you so much. If you like, please don't forget to subscribe, comment, and like. So stay tuned, guys, for the next life-changing video because our life matters and happiness begins with good health. Bye, guys.